Oh hi, welcome back to the workstation. Today I have a very curious case of a young female that suffered a gunshot wound to the back and survived. This is a ER case. This female patient was mugged on the street and she instinctively reacted to the approach of the mugger, and he had a gun and shot her. So as soon as she was shot, she fell down to the floor and the mugger ran away. She was then helped and rescued by an ambulance and by people passing by, and she was taken to the ER where the doctors ordered an enhanced CT scan of the abdomen to look for how deep and how serious the lesion was. Just to be clear, she was all covered in blood, but she was alive and apparently well, which is really uncommon to gunshot wounds. She was hit on the belly and survived. So let's check the images and understand what really happened. So this is an enhanced CT scan of the abdomen. If this is your first time here, let's just do a quick recap. This is a CT scan, a cross-sectional image modality, a computed tomography scan. These are axial, transverse, cross-sectional images of the abdomen from the base of the lungs to the bones of the hip. So the patient is laying down on the scanner table. She goes head first into the scanner. Her belly is facing the ceiling, and we have to picture ourselves as if we were sitting by the sole of her feet, looking forward. So this is front, this is back, this is left, and this is right. This is the scanner table, and this is the patient. So let's see what we can find. It's a gunshot wound to the abdomen, and the doctor said that he could see both the entrance wound and the site where the bullet got out of her body. So we won't be able to see a large gunshot fragment, metallic gunshot fragment, but we should be able to look to see a site, two sides of soft tissue laceration. It may be some other kind of laceration. So as we scroll down, these are the ribs, and we can already see there is some kind of soft tissue damage right here. Let's just scroll up. There isn't much right here. Let's see if we can see a skin lesion that represents the entrance site of the bullet. So this is it. This is a skin laceration right here. This is where she took the shot to the right side of her belly, pretty close at the same level as the right kidney. I'll just split this view in two once again, so we can see the pre-contrast, the unenhanced image, and the post-contrast, the enhanced image of the abdomen. This is contrast enhanced. So see how dense this is. This is related to blood. This is a blood trajectory of the bullet. So the bullet goes from the right side, takes skin, soft tissue from subcutaneous tissue, hits the perivertebral muscle, goes all the way to the spine, and does it go? It's going up. No, it's exit. This is the exit wound. This is the exit wound right here. This laceration is the exit wound. So maybe if we hit the multiplanar reconstruction, we can actually see the entire trajectory of the wound. Just see right here. This is the entrance side of the lesion, the bullet, so it was horizontal. And this is the exit wound right there, pretty close to the vertebral spinous process. Maybe in the sagittal view we can see it better. Right there, exit wound right here. Right here, the exit wound is right here. And this is the entrance wound of the projectile. I guess the coronal view is better. Let's just get to the coronal view right here. Maybe the axial view. Axial view is the best one, really. Yeah. The gunshot came from here to here in a oblique and upwards pattern, exiting pretty close to the spine. It seems it didn't hit any major structures. Let's just be sure of it. I'm just going to hit soft tissue window right here and get a enhanced sequence, a enhanced series right here. So we can see the liver is right here. There are no liver laceration visible. Oh, there is a very, very tiny nick, very tiny hit to the kidney, which is really odd because there is some densification of the pararenal soft tissue. So the kidney fat tissue, extraperitoneal fat is densified, which means there is blood right here, but the kidney itself is pretty much normal, just a bit of maybe a burn wound due to the proximity of the actual trajectory of the gunshot. So this is a very minor lesion to the kidney, and it doesn't look like bone was hit. No. The projectile exit the body pretty much a few centimeters away from the spine. So there was no lesion to the spine, just a lot of lacerations to soft tissue, muscle, skin, and subcutaneous tissue. Were there any kind of fracture to the rib cage? The rib cage is right here. Did it fracture a rib or something? No fractures to the rib cage. So this is a very, very lucky case. Very, very lucky woman. She was mugged, shot, and she had no major injuries to internal organs, spine, or anything else like that. She just had a bullet trajectory inside her body from right to left, from front to back, and the only structures that were hit were soft tissue lesions, which aren't of major importance. This really justifies she being all covered in blood, in a lot of pain and panicking, but she was really lucky, and I'm really sure she survived this mugger attack. So this is it. If you enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. Just click and keep watching. Thank you so much for watching, and I see you in the next one.